Everyone, I'm Dr. Mike Kamali, Chair of Emergency Medicine here at the University of Rochester Medical Center. Wanted to talk a little bit about the bus crash and our response locally in the greater Rochester community. Yesterday afternoon at approximately 5:30 or 5:40, we received a phone call of a tour bus crash in Steuben County that involved nearly 40 people. We got initial reports from EMS and from police agencies, and at that point in time we started to plan, anticipating that we may have a number of patients coming to Strong Hospital. As many of you know, Strong serves as our region's level 1 trauma center, which means that we get the most critical of trauma patients who are injured in any type of accident. At that point in time, we started to pool our resources together throughout the hospital, which not only included physicians but also nurses and all sorts of additional staff, from our housekeeping staff to our registration folks and all others, bringing those people together to start in clear space in our emergency department and our ICUs to anticipate the patients that would be incoming to us. We started to receive patients approximately an hour later via Mercy Flight and ground. We received a total of 4 patients yesterday late afternoon, early evening, and 3 additional patients were transferred to Strong Hospital in the overnight hours. Currently, we have 7 patients in the hospital. 3 are currently undergoing evaluation, 3 are in guarded condition, and 1 is in satisfactory. So we have several levels of response that we have in the hospital. The highest level of response is a disaster response, where that calls in all sorts of staff, all sorts of people, activates multiple operating rooms, and etc. We did not activate that yesterday because the initial reports on the number of patients we would be receiving wouldn't necessarily warrant that type of response. So our response was really a step below that, where we did make phone calls to physicians within the area, getting both emergency physicians and our trauma physicians involved, also getting our orthopedic physicians, neurosurgeons, and those folks aware of what was going on and what we might need to anticipate. As well as that, we had additional nursing staff that came to the hospital. And we have some things in-house available to us in the emergency department just in terms of preparation, getting things ready. That also involved moving patients throughout the hospital, trying to clear up space within the emergency department, again, not knowing how many patients we would be receiving. In terms of just trying to get ready, trying to clear rooms, clear space, clear up help in radiology and etc., just getting everybody primed to deal with whatever was coming. Certainly the people that were involved in this accident had life-threatening injuries, and the fact that they were transported via ground or via air to our hospital, that I believe constitutes life-saving measures. Had they not been transported, the injuries that they had could go on to become life-threatening or life-ending.
How many would you say of the 30-some passengers in that bus?
Well, I can only comment on the people that we saw last evening, and those are the 4 people presented to us, and all of those folks had significant injuries. When we heard that there's a bus crash of approximately 40 people, I'm anticipating to potentially get 40 patients into my department. In reality, I recognize that that probably is not going to be the case, that some folks will be uninjured, that some folks will go to local hospitals, but we were ready and willing to take whatever we needed to take care of the patients and take care of our community. You never like to deal with these sorts of circumstances, not knowing what is going on and anticipating a tour bus where people are on vacation, going to have fun. We didn't know if there were any children who were involved, but things went as expected. We got the information we needed, and we were prepared to handle more patients if we had to.